to Beyond Wellness with Big Ben. Today I have with me pharmacist Solomon Belde, and he is the head of pharmaceutical department of Specialist Hospital Gombe. We're going to be discussing a very exciting and important topic to the society and to everyone out there, which is patients and drugs, use and misuse of drugs. Don't go anywhere, don't touch the dial, we'll be right back. Welcome to the show, sir. Okay. So, a lot of people don't know the meaning of drugs. They just hear drugs. They don't know the meaning. They don't know the difference between drugs or drug abuse. Please, can you tell us the definition of drugs in general?
The general definition of drugs has it that drugs are any substances that once we take them cause physiological changes, it will also cause physical changes in the body. So any substance we take.
The difference between the misuse of drugs and drug abuse. Thank you.
Thank you. That's a nice question. Misuse and abuse. Misuse leads to abuse. Because without misuse, there will never be an abuse. For instance, somebody goes to the hospital and he meets a physician, and the physician gives a prescription for that person. And the person goes and gets that medication and use it. We say the person is engaging in use of that medication. And when you look at it more further, and it happens with, I can say in Nigeria, I don't think there's anyone that will say he has never engaged in misuse. Why? You are having an headache. You just look at it and say, if you have a colleague or a neighbor that has medication, the person tells you, I have this drug, instead of giving them use it. That is misuse. Because there was no prescription generated. Nobody diagnosed you of having headache or running temperature. And you decide to go on your own to take a medication. That is misuse. Now what about the drug abuse? If you continue doing it, you're not getting prescription, you continue using that medication, and you use it for purposes that it was not intended for. Yes, when we look at official books, we have drugs there, you will see the drug, you will see the uses. We know that there are medications that have unofficial use. And if you see it, it is said this drug, this is the unofficial use of that drug. And still it is captured in those official books so that you know how to use that medication. That is, in general practice, once we look at management of a condition, we look at medication and drugs that are there. We see those uses there. And at times we will now see that these drugs are used for other things, other conditions. Once that is applied, it is not misuse. But when you go to the extent of you are using it outside of what it is known for, it is misuse. Then that misuse, for example, you have people that take certain kind of medication because they want to feel that euphoria. Some will tell you, I want to feel high. Or the first time they use a particular medication, it gives them a kind of feeling. That's the feeling we call euphoria. And because of that, they want to still experience it. And by the time they start using this medication just to get that experience, it is now what is called abuse. It is what is called abuse. And this thing happens with some kind of medication, not all. Because we all know you can't take paracetamol. Paracetamol doesn't make you feel high. Ibuprofen doesn't make you feel high. A lot of people, the first time they take pentazocine, the feeling they get from it makes them want to go and start drinking and using. And by the time they start doing that, just to get that feeling, it is what we are now calling these persons are using this drug. And then, if you look at, now that's for drugs that cause somebody to feel high. There are other medications that don't cause you to feel high. For example, if I ask, we are looking at this our group here. If I said, raise up your hand if you know you've used artemether lumefantrine, anti-malaria before when you didn't get prescription. I think even myself, there's possibility my hand to go up. And if I continue doing that without getting prescription, anytime I feel I'm not having feverish condition, I go and take that anti-malaria. I am abusing it. Okay?
Thank you so much, sir. Okay, let's talk about the types of drugs people misuse, like vitamin C. So what can you tell us about these drugs? Is it that it has any effect on us? Like sometimes we take a lot of vitamin C because of the sweetness. So does it have any effect on us?
Okay, thank you very much. It's nice that we are looking at one very common medication, very common drug that is easy to abuse. I don't think there's anyone seated here that will tell me that he has been to the hospital before and then prescription was made for him or her to take vitamin C. Usually we see the doctor will tell you 200 milligram TDS, that's 8 hourly. And sure, once you have it, if it is that one that is sweet, you are tempted to even finish everything, especially if it's getting that that was given to you. Actually, vitamin C, if you're looking at aspect of side effects, the only side effect you get for vitamin C is when you take a very large dose. And what large dose of vitamin C will do for you is to cause glucose neogenesis. Your liver will release glucose into your body. And if it is somebody that keeps on doing that and you have to run a test on that person, there's every possibility that you might be tempted to say, this person have done this test 2-3 times, fasting blood sugar test for that person or random blood sugar test for that person. You can easily now say, this person is diabetic when the person is not. So you can see what consuming very large volume of vitamin C can do. Yes, somebody can argue. I can go by the side, by the low side and buy a lot of bullet. By the time I like taking bullet, I will take a lot of it. It's not the same. Of course it's the same. So with respect to vitamin C, it does not directly cause a side effect, but it can cause you to have a problem with another medication. I started talking about artemether lumefantrine tablets. It is a medication that needs to be broken down, to be converted to the radical form for it to be absorbed, for you to get its effect. If you take vitamin C alongside that medication, what will happen is you will never get the effect of that anti-malaria. And then we'll end up saying, that drug I took is fake. And it's not fake. So yes, there are certain medications that you can hardly hear somebody talking about side effects. And then for somebody that has ulcer, now we are looking at somebody having a condition that doesn't warrant him to take certain medication. If the person uses vitamin C on an empty stomach, and the person is an ulcer patient, an aesthetic ulcer patient, the person comes down with severe epigastric pain because vitamin C is an acid. Okay? So if you take it empty stomach, you are increasing the acid content of your stomach and it does harm to you. Thank you very much.
Thank you so much. Lastly, before we go, can you give us a general advice?
Everyone is a culprit of drug misuse, but not everyone is a culprit of drug misuse. Advice will be, anytime you are down, you're feeling sick, it is wise and better you go to a healthcare facility so that you get the prescription. And once you get that prescription, it now makes it legal for you to obtain any medication that is in that prescription. Because without doing that, you are abusing, you are misusing. And by the time you start misusing, before you know it, you end up abusing because you feel you are the doctor of yourself. You can easily say, okay, if I'm having this is the medication. I've used it before, it has worked for me. And it is not just you, it could be affecting. Because I'm telling you the truth. By the time you use it, you feel okay, it has worked for you. Your friend says, I'm having this. It's not a similar thing I had. Take this. Especially when we look at our nation, the number of healthcare professionals to the population of the country is nothing to write home about. A lot of people will not go to the hospital once they know they can just take this. And when it comes to certain medication, we call prescription only medication. How on which there is a policy, it is there, but the problem is enforcement. If only this can be enforced, that any medication that is prescription only medication should not be dispensed. Even if you go to a pharmacy premises or a patent medicine shop, if they don't see prescription, they should not dispense that. And if that will happen, that is the only way we can really say we address issues of misuse and abuse. So, you and I were sitting here. We can look at ourselves as ambassadors that are saddled with that responsibility of ensuring that misuse and abuse are addressed. Because if we don't start from our own side, there's no way. And we all that are healthcare professionals, it is our responsibility to ensure that we advise everyone we know. Because if you have 100 people and they decide to advise 10, and those 10 decide to advise other 10, before you know it, the whole country will pick up. If all hands will be on deck, all healthcare professionals in the country will decide to say today they are going to educate the masses on abuse, misuse, then they say we'll achieve something. If not, there's nothing that will come out, no matter the talk that somebody do. Thank you very much.
Okay guys, we've come to the end of this episode. Remember or have it in mind that with you and me there can be a society free of drug abuse. So don't forget to like, share and comment. Let's know your opinion on this. Until I come your way next time. Bye!